Diabetes is a serious and growing health problem that affects millions of people across the globe, regardless of age, gender, or background. It doesn't discriminate, touching families and communities in every country, and its impact is only increasing as time goes on. At its core, diabetes is a condition where your body struggles to control blood sugar, also known as glucose. This happens either because your body doesn't produce enough insulin, or it can't use the insulin it makes effectively. Glucose is a tiny sugar molecule that fuels our bodies, giving us the energy we need for daily life. But when there's too much or too little in the bloodstream, it can cause serious health issues, affecting everything from your heart and kidneys to your eyes and nerves. Over the past few decades, the number of people diagnosed with diabetes has been rising at an alarming rate. This trend is seen in both developed and developing countries, making it a truly global concern. Experts link this increase to several factors, including rising obesity rates, unhealthy diets high in sugar and processed foods, and a lack of regular physical activity. Our modern lifestyles, with more screen time and less movement, play a big role. Diabetes is, without a doubt, a global epidemic that demands urgent attention and proactive management from individuals, families, and healthcare systems alike. Gaining a clear understanding of diabetes is the crucial first step toward both prevention and effective management. Education empowers us to make informed choices and support those at risk. By learning about what causes diabetes, recognizing its symptoms early, and exploring available treatment options, we can take meaningful steps to protect our health and reduce the impact of this widespread condition on ourselves and our loved ones. To understand diabetes, we need to understand how our bodies use sugar. When we eat, our bodies break down carbohydrates into a simple sugar called glucose. Glucose is, well, like fuel for our cells. Our pancreas, a small organ near our stomach, produces a hormone called insulin. Insulin acts like a key, allowing glucose to enter our cells from the bloodstream and be used for energy. In a person without diabetes, this process works efficiently. However, in diabetes, this process is disrupted, leading to high blood sugar levels. This can cause a range of short-term and long-term health problems. Type 1 diabetes is an autoimmune disease where the body mistakenly attacks and destroys the cells in the pancreas that produce insulin. This means the body can't produce enough insulin to regulate blood sugar levels effectively. Type 1 diabetes typically develops in childhood or adolescence, but it can occur at any age. It's not caused by lifestyle factors and cannot be prevented. People with type 1 diabetes require lifelong insulin therapy to manage their blood sugar levels. This usually involves regular insulin injections or the use of an insulin pump. Type 2 diabetes is the most common form of diabetes, accounting for about 90% of all diabetes cases worldwide. This chronic condition affects millions of people, and its prevalence continues to rise, especially in developed countries. Unlike type 1 diabetes, which is usually diagnosed in childhood and is not preventable, type 2 diabetes is often linked to lifestyle choices and environmental factors. In type 2 diabetes, the body either becomes resistant to the effects of insulin, or the pancreas doesn't produce enough insulin to keep blood sugar levels within a healthy range. Over time, this can lead to chronically high blood sugar, which may cause serious health complications if not managed properly. Early detection and regular monitoring are crucial for effective management. Several factors contribute to the development of type 2 diabetes, including obesity, physical inactivity, unhealthy diet, and family history. Consuming high amounts of processed foods and sugary beverages, combined with a sedentary lifestyle, significantly increases the risk. Genetics also play a role, so having a close relative with diabetes can make someone more susceptible. While there's currently no cure for type 2 diabetes, it can often be managed, and sometimes even put into remission through lifestyle changes. Losing weight, eating a balanced diet rich in whole grains, fruits and vegetables, and exercising regularly are key steps. Working with healthcare professionals, such as dietitians and fitness coaches, can help individuals create a sustainable plan for long-term health. Some people with type 2 diabetes may also need to take medication to manage their blood sugar levels. These medications help the body use insulin more effectively or stimulate the pancreas to produce more insulin. In some cases, insulin injections may be necessary. Regular checkups and open communication with healthcare providers are essential for keeping diabetes under control and preventing complications. Gestational diabetes is a type of diabetes that develops during pregnancy in women who didn't have diabetes before. It happens when the body can't produce enough insulin to meet the increased demands of pregnancy. Gestational diabetes usually goes away after pregnancy. However, women who have had gestational diabetes are at increased risk of developing type 2 diabetes later in life. Managing gestational diabetes is, really crucial for the health of both the mother and the baby. It typically involves monitoring blood sugar levels, making dietary changes, and engaging in regular physical activity. Diabetes often develops gradually, and early symptoms can be subtle. Being aware of the warning signs and seeking medical attention if you experience any of them is essential. Common symptoms of diabetes include increased thirst, frequent urination, unexplained weight loss, increased hunger, fatigue, slow healing sores, and blurred vision. It's important to note that not everyone with diabetes will experience all of these symptoms. Some people may have diabetes for years without showing any noticeable signs. If left unmanaged, diabetes can lead to a wide range of serious complications affecting various organs and systems in the body. Over time, high blood sugar levels can damage blood vessels and nerves, increasing the risk of heart disease, stroke, kidney disease, nerve damage, also known as neuropathy, vision problems like retinopathy, and foot problems such as diabetic foot. Managing diabetes effectively is honestly crucial to prevent or delay these complications and maintain overall health and well-being. Regular checkups, medication adherence, and healthy lifestyle choices are essential for minimizing the long-term impact of diabetes. Diagnosing diabetes involves a simple blood test to measure blood sugar levels. Your doctor may recommend one of several tests, depending on your individual circumstances. The most common tests include the fasting plasma glucose test, which measures blood sugar after an overnight fast, and the A1C test, which provides an average blood sugar level over the past 2 to 3 months. In some cases, your doctor may also recommend an oral glucose tolerance test, or OGTT, which involves drinking a sugary drink and measuring blood sugar levels at specific intervals afterward. Managing diabetes effectively involves a combination of medical treatment and lifestyle modifications. The specific approach may vary depending on the type and severity of diabetes. Treatment options include insulin therapy for people with type 1 diabetes and some people with type 2 diabetes, medications to improve insulin sensitivity or reduce glucose production, and regular blood sugar monitoring. Lifestyle changes are crucial for managing diabetes and preventing complications. These include adopting a healthy diet, engaging in regular physical activity, maintaining a healthy weight, and avoiding smoking. While not all types of diabetes are preventable, making healthy lifestyle choices can significantly reduce the risk of developing type 2 diabetes. By taking small, consistent steps each day, you can make a meaningful impact on your long-term health and well-being. Prevention starts with awareness and a willingness to make positive changes, no matter your age or background. Maintaining a healthy weight through a balanced diet and regular exercise is crucial. This means being mindful of portion sizes, eating at regular intervals, and finding enjoyable ways to stay active. Even simple activities like walking, gardening, or dancing can contribute to a healthier lifestyle and help manage your weight. Choosing whole grains, fruits, vegetables, and lean protein sources provides your body with the nutrients it needs to function at its best. These foods help stabilize blood sugar levels, keep you feeling full longer, and support overall energy throughout the day. At the same time, limiting processed foods, sugary drinks, and unhealthy fats can make a big difference. Reading nutrition labels and making informed choices at the grocery store or when dining out empowers you to take control of your health. Regular physical activity, aiming for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week, is essential for maintaining healthy blood sugar levels. Activities like brisk walking, swimming, or cycling not only help control weight, but also improve heart health and boost your mood. Finally, getting regular checkups and being aware of your family history of diabetes can help identify any early signs and allow for timely intervention. By working closely with your healthcare provider and staying informed, you can take proactive steps to protect your health and build a brighter, healthier future for yourself and your loved ones. Diabetes is a complex condition, but understanding its causes, symptoms, and management strategies is crucial for individuals living with the disease and for society as a whole. By raising awareness, promoting healthy lifestyles, and supporting research efforts, we can work towards a future where diabetes is no longer a silent killer, but a manageable condition.